Hi everyone, we are going to talk about the different types of respiratory disorders. So make sure to watch this entire video so that you know the different types of disorders and the different categories that they fall under. So first, we have our obstructive disorders. And these are disorders that cause airflow obstruction. So think about like asthma, COPD, bronchiectasis, and also sleep-disordered breathing like sleep apnea. These are all considered obstructive disorders because they cause airflow obstruction. Then we have our restrictive disorders. These disorders limit lung expansion. So these would be things like a pneumothorax, which is a collapsed lung. It could be a pleural effusion, which is like an abnormal collection of fluid in the pleural space. It could be pulmonary fibrosis, which is a restrictive lung disease. It could also be thoracic cage limitations, such as with scoliosis. And then also ARDS, which is adult respiratory distress syndrome, can be considered a restrictive disorder. Next, we have our vascular disorders. And these are disorders that affect the blood flow in the lungs or the blood flow to the lungs. So this would include things like pulmonary edema, which is fluid in the alveoli or fluid in the lungs. It could also be a pulmonary embolism, which is a blockage in the pulmonary artery. And then also pulmonary hypertension, which is high blood pressure in the pulmonary artery. And lastly, we have our infectious disorders. Now these can be upper or lower respiratory tract infections. So let's start with the upper respiratory tract infections. We have things like epiglottitis, which is inflammation of the epiglottis. This can be a very serious infection because the epiglottis can become swollen and it can cause a blockage in the upper airways. And then we have our lower respiratory tract infections. These are infections that occur in the lower respiratory tract. This would include things like acute bronchitis, which is inflammation of the bronchi. Then we have pneumonia, which is inflammation of the lung tissue. And this can be caused by bacteria, viruses, fungi. And then also we have a lung abscess, which is a collection of pus in the lungs. And this usually occurs with pneumonia. And then lastly, we have tuberculosis, which is a mycobacterial infection that can cause a lot of symptoms like a chronic cough, fever, night sweats, and weight loss. Alright, so I hope this was helpful. Make sure to like and subscribe. Thank you so much for watching.